discussion that came out, which is, hydroxychloroquine, normally a treatment for malaria. Data has, come in and shows that it does not support its use as a treatment for COVID. So as I mentioned, I was asked to consider the methodological lessons that can be learned from this recent wave of evidence and information that we've been presented with. And without going through all 3 million papers published, I've tried to pick out a couple of considerations. The first is really scientific integrity, and I think that methods, when you're trusted with data, it's an important area to focus on. And this is really highlighted by the Surgisphere scandal. With Surgisphere, an American healthcare analytics company established in 2008, they claimed that they had a data set of 100,000 detailed patient records from 700 hospitals on 6 continents. And the data set apparently also included information on the anti-malarial hydroxychloroquine. Research findings were published in the 2 highest impact journals in medical science, The Lancet and New England Journal of Medicine. But The Guardian noticed The Guardian, a newspaper here in the UK, noticed a couple of inconsistencies in the data and requested access to it. Dr. Desai refused to release the data, and he cited patient confidentiality as the reason. Since then, the health institutions have denied ever agreeing to share any data with Surgisphere, and the papers have been retracted from the 2 journals, with the only explanation being at the moment that the data was completely fabricated. Since then, trials have actually showed that hydroxychloroquine has no harmful or beneficial effects amongst COVID-19 patients. So first consideration is integrity. The second is the importance of sensitivity analyses and actually communicating results effectively. There was an analysis of a large data set from the UK that combined primary healthcare records from 17 million adults with records from mortality records for 11,000 COVID-19 related deaths. And it brought up an interesting methodological discussion. The analysis came out in the preprint journal medRxiv, and following that was sort of open to the public and anyone could really comment. And it was actually Ellie Murray, also known as @EpiEllie on Twitter, that led a discussion about some of the communication or possible interpretation of the paper. The paper investigated a number of sort of risk factors for COVID-19 mortality. So what might predict whether or not you die of COVID-19. And whilst some of the results sort of fitted with some of what was being seen and believed to be predicting death, so male sex, obesity and older age, and there was also deprivation as well. There was one strange result, which was smoking. And here what I'm showing is sort of a hazard ratio. So with one being no difference. So if this hazard ratio here of 1.25, I can use my mouse to shows that in an unadjusted model, so not controlling for differences between people, current smoking looks like it increases people's risk of death. Whereas once you control for a lot of different factors, it looks like actually current smoking is protective of death related to COVID-19. So that caused a lot of confusion, and luckily Ellie Murray was there to help out. She neatly demonstrated the possible cause for this sort of switch in the association between smoking and COVID-19 death. This is mainly due to sort of, in the fully adjusted model, they controlled for a number of factors that lie on the sort of the pathway between smoking and COVID-19 death. And so, and what happened is this induced a relationship. Well, there was sort of a more distant cause for both for heart disease amongst smokers, which was social determinants of health, or believed to be, that actually induced this association between current smoking and COVID-19 death. The paper was accepted and published in Nature, and it's really interesting to see that they actually included a post hoc analysis that investigated this in more depth. And they were able to show that sort of in a stepwise adjustment that it was actually chronic respiratory disease that was the source of this confusion. And that actually, if you weren't to adjust for chronic respiratory disease, which lay on the causal pathway between these two factors, that there was in fact no association between current smoking and COVID-19 death. Sort of the importance of this example is that it highlights the need to sort of follow up on unexpected results and to try and find possible explanations for these. As sometimes these results can be sort of taken and interpreted by in ways that authors might not necessarily want them to be interpreted as. And just to be clear, the authors in this paper were very, they were very clear about it being a descriptive analysis and only referring to association, not causality. So the third consideration sort of to focus on is unpacking the black box of quantitative analysis. Regression is a wonderful tool that you can use to model the relationship between two variables. As I'm sure many of you are aware, it's possible to fit not just a linear regression model, but also you can include terms that mean that you can model different relations, curvature in your relationships, if you believe that that fits your data better. So I was interested to see in a recent article the use of a sort of non-parametric method, that sort of you would use to model smooth lines between data in an investigation of whether or not immunity wanes after coronavirus infection. So in this graph, what you've got here is days post onset of symptoms and your antibody levels of antibody in circulating antibody, which is normally used to sort of raise an immune response against COVID-19. So the authors gave no justification in this analysis for their choice of this particular curve, regression approach, and certainly didn't discuss the uncertainty around. Here there are much fewer data points, so we're much less. This sort of drop off at the end is not as clear whether or not that would really be replicated if you were to rerun this experiment. So they did discuss that it's not clear whether the decline will continue on a downward trajectory or plateau, but they never explored that potential hypothesis using alternative curves and used any statistical method to compare different curves applied to the data. and this really sort of reminds me of this cartoon, which highlights sort of how different lines can be drawn through the same data, and without sort of using any method to discriminate between those different lines, any sort of conclusion can be drawn from that data. So finally, you know, data is difficult, and they're really, you know, the distinction between, as I sort of said earlier on, the distinction between quantification and divination is related to how, I believe, is how transparent you are with your methods and the rigor with which you follow up on alternative explanations. So back in June, Nature published this article, 5 Ways to Ensure That Models Serve Society, a manifesto. And it was really in response actually to the sort of mathematical models that came out early on in the epidemic, which, you know, in those early days were used to sort of decide on, help inform big decisions. Whilst it sort of focuses on mathematical models, it certainly applies to other types of modeling. And the principles can definitely be used elsewhere in other forms of research. So the 5 areas are these: to assess uncertainty and sensitivity, which I sort of touched upon in the first, the analysis of COVID-19 mortality and risk factors for that. And then also secondly, balance complexity with relevance. And in a way, I think that the analysis of risk factors for COVID-19 mortality sort of speak to that too, rather than sort of investigating sort of whether or not each of those factors was causally, you know, a true cause of COVID-19 mortality. It was useful in those early days to know what really was sort of associated and what really were, and the strength of that association. Then there is matching purpose with context. So I think that sort of relates to the choice of curves, which type of curvature you fit to different data. And in a sense, you know, as a researcher, you're able to, you know, you can use data to tell a story, or you can investigate the story within the data. And I think that it's our responsibility not, you know, to go with the second there. Also be conscious that quantification can backfire. And lastly, I think importantly is, especially when, you know, a lot of scientists are pressured to give answers, to also acknowledge that, you know, for some questions that there aren't answers that lie with data. And so those are just a kind of a summary of a few methodological considerations from the COVID-19 pandemic so far. Thank you.
Thank you, Dr. Will. I'm not sure we have enough questions and answers at the moment, but if you do have any questions, I could ask that in the chat box. So we'll be moving to the discussion now, which is, can you talk to things virtually and get meaningful data?
We have some questions with hands up. So I see Lucy's hand is up. I think we can take some questions, Lucy.
Wonderful. Would it be possible for everyone to mute? I think someone's walking on scrunchy gravel right now.
I can't hear you, Lucy.
Can you hear me a little better now? Wonderful.
Oh, that's perfect.
Great. Thanks everyone for muting. So this is 2 absolutely fascinating and very different presentations, and thank you. Really, really excellent. I have a question for each of you, if that's okay. Elika, you mentioned, I thought really perceptively, that storytelling could be used to smooth the delivery or smooth interventions, make them more, I guess, what I understood from that was make them work better and be more acceptable. And I'd just love to hear whether there's any examples of that that you saw or heard about that we could think about. And Will, I had a question for you, which is that, you know, this was some wise cautionary tales here. Oh, sorry, I could stop my video as well. Some cautionary tales here. And I wondered, you know, as we embark on analysis, which is primarily statistically going to be work package 2 observational cohort analyses, are there particular things which jumped out to you which we should be thinking about as we start to run these models that may matter more now than ever before? You know, the things to like stick up, you know, Mark Orkin always says, you know, you stick a couple of key messages on your computer screen on sticky notes, and what would those be?
Thanks, Lucy. The direct answer to your question about whether there are examples of kind of in the current context of interventions that have been smoothed through storytelling approaches, methodologies, just through storytelling, I can't give you a direct example there. But I do know that if we look at groups in Kenya, for example, the local museums project, where people have been trying to, you know, respond to the election unrest that flared up a few years ago, and people have come together to share stories of their own experiences and to bring objects that are particularly related to those experiences. That has helped with, you know, again, I mean, you know, this relates to Will's paper. There isn't, as it were, concrete data, but it is clear that communities have come together around these museums. I mean, when I say museums, I mean really just people meeting in a community hall or a church, and sharing their stories. There are, you know, it would be possible if you gave me, you know, a couple of days to bring together a number of studies that that show that storytelling has been incredibly effective in not only in teaching people, for example, about, you know, I don't know, environmental crisis, such as Wangari Maathai, who was on my second screen, did, but not only for teaching, but also for being in community together. And when people feel that they're in community in a kind of peaceful and stimulating way, that does improve their, if you like, receptiveness. I mean, there is research to show this, that does improve their receptiveness to new information.
That's fantastic. Thank you, Alika. Really helpful. Will, on the spot?
Yeah, thank you, Lucy. I think that there's a couple of, you know, sort of tried to keep it high level, because I think that the higher the level, then the more applicable it is to other research. And I think that the second area is, you know, with particular application to work package 2 is sort of keeping an idea of the relationship between the different variables that you include in your analysis, and how the, you know, associations that sort of are happening in the background that aren't related to, you know, the investigation between accelerators and outcomes might be influencing those. So sort of you know, keen critical kind of thinking about, you know, the models that are being put together for these analyses, and again kind of willingness to really kind of follow up on sensitivity analysis. There's, you know, I think it's starting to become more popular, and sort of journals are more sort of forward with asking for them to be included in papers, but, you know, going to journals with them as well, you know, they'll be much more you know, well, not just from the journal's perspective, the journals will be more, you know, like to see that, but just, you know, exploring the different ways that possible ways that results might change is important.
Thank you. I'll let other people ask questions now. Thank you. Well, it's great. You're going to put sensitivity analysis on our sticky note.
There are two questions in the chat, Alika. Should we ask
I'm just
them out, or can everyone see them?
oops.
One about sort of sampling and analysis, and another one about reaching more difficult groups, perhaps people who have hearing or visual impairments or other vulnerabilities. So if you
Thanks. Yeah, I do see them. Thanks, Lorraine. And they're both really great questions. So analysis and sampling for representation. I mean, it depends, because narrative analysis is qualitative rather than quantitative. It really depends on the, if you like, the narrative-based project that you're looking at. But there are ways of assessing, you know, mental health benefits in those projects that does allow some pretty kind of close data-based analysis. Storytelling for adolescents living with disabilities. You know, those adolescents will have access to language or communication of some kind, and where an individual has access to, you know, to, if you like, sign language, for example, then storytelling is possible. Any kind of language makes storytelling possible. I mean, storytelling, it's a very, I suppose this is, you know, underlies all my research on narrative. It isn't that narrative is an add-on, you know, it's absolutely part of the warp and weft of our social being. So, so yeah, just to kind of, you know, emphasize that. Do we need formal training to carry out storytelling interventions? Yes, probably. I mean, having said that narrative, that storytelling is kind of natural to human beings, I do think that storytelling analysis does require skills. I mean, both skills of kind of collecting data, for example, on, you know, mental health benefits, but also I think some narrative and training in narrative analysis, sort of kind of looking at the storytelling patterns that work effectively. I mean, you know, some stories fall into beginning, middle, end patterns, and others have, you know, before and after. Social media stories are very much before and after stories. And it would be very interesting to do some analysis on, you know, how, you know, which kind is more effective and in which context. And in that, yes, sure, formal training would be useful, but it is, I mean, it's not, you know, I spent seven years getting my PhD in narrative analysis, but I think I could have carried out some of this research after the first year. That's it.
Great. Okay. Well, we've had this interesting grounding from the narrative and the story to some very wise words about cautions and data, and the two sticky notes, Lucy, that I'm going to put up from this launching of our ideas is warp and weft and acknowledge your ignorance. Those are going to be on both sides of my screen. So you've set the scene so beautifully to us now moving into 4 talks, which I hope will be quite quick talks, but to allow us to have a discussion at the end where we have 2 invited guests who are carrying out work both in South Africa, who are going to tell us a little bit about their experiences of collecting data in lockdown and diverting or changing studies. And then our own Jackie, who works with the Stellenbosch team, which covers quite a lot of both work package 2 and 4, and of course our tag work by Leslie. So can I ask Jane, and introduce Jane to everyone, to begin. We've given each of them 10 minutes so that we can get a taster of their work, and hopefully we'll get much more depth when we have our final half an hour to have questions. So Jane, the floor is yours. Do you need to share some slides?
Jane, is it possible that you're muted?
And we lost Jane. Jane's here. I spoke to her in the beginning, although I don't see her now. Okay, so should we...
Can you hear me now?
Ah, there we go. Thank you, Jane. Yes.
I'm not sure whether you can, how I can allow my first slide to show. It's on my...
Press the share screen button. The sort of green square button at the bottom. Or alternatively, Katie or Suha can do it for you.
Share screen, right.
Okay, we seem to have your screen. Excellent. So if you just press the button for full screen on the right, that's lovely. Go for it, Jane.
Okay. There we go. Okay, just to speak quite quickly, I wanted to show the picture of the Valley of 1,000 Hills because it shows you in a picture a place where people are generally very poor, where roads are difficult, where communication is difficult, and also where situations are very difficult. You can either be on a very steep portion or you can be down near the Umgeni River. You can either be near a center, an industrial center where there are jobs, or far away on the other side of the Umgeni River where it's a long way to any employment opportunities. So now for my, just to give you a quick background, my study is a sub-study of the main Ascente study, which is a study of child development started some years ago, and particularly focused on HIV, which was the epidemic of the time. And there were 1,500 participants, 4 to 6-year-olds. We've seen them a couple of times since then. So it's a longitudinal study. It's now in its 3rd phase. The children are adolescents, and the main focus of the big study is risk behavior in adolescents. So the present sub-study is a qualitative account of the effects of the government lockdown on the Ascente participants. I'm going to, if I move away a bit, the lighting is very poor here. The aim of the study, the overall aim of the sub-study is to understand the variety of experiences in the sample area to assist our interpretation in the main study. So we've